Hello.
Hi, Mari. How are you?
Hi. Good. How are you doing?
I'm doing great. Just going to turn you up a little bit.
Okay. Yay. I'm so happy to be doing this with you.
It's great to see you again. I hope you're surviving the cold weather out there.
Yeah. Yes, I know. It's the weather's just been very confusing, to be honest.
Yes,
But
that's
glad to be.
Colorado.
Yep. Exactly.
Yeah.
Um, yeah. Well, I'm so excited to be doing this, and I know we talked first about maybe introducing ourselves before we get the conversation going. If you don't mind telling us a little bit about you and your background, I'm happy to do that afterwards.
Okay, sounds great. Hi, everybody. My name is Dr. Sara Barton. I am a board-certified reproductive endocrinologist, and I work for the Colorado Center for Reproductive Medicine, CCRM, here in Denver, Colorado at our flagship location. A board-certified reproductive endocrinologist means that we go through 4 years of residency in obstetrics and gynecology, so learning about general women's health, obstetrics and gynecology and deliveries, and then 3 additional years of training specializing just in fertility. So typically reproductive endocrinologists, myself included, are going to take care of women who are planning for pregnancy, actively trying to get pregnant, preserving their fertility, things like that. So that's what I do on a daily basis.
That's wonderful. Yeah, and my name is Mahri Relin. My company is Body Conceptions. We are actually celebrating our 10-year anniversary next month, so excited about that.
Congratulations.
Thank you. We started in New York and we've expanded to Denver as well as having trainers in San Diego and Dallas. But just a little bit about our method. It's a dance-based fitness method, but we always tell people you don't have to be a dancer to do it. We just use dance principles and it's very music driven. And we also do mostly private training in-home and virtually. But yeah, I wanted to talk a little bit about my journey personally in the company, coming to understand and want to know even more about fertility. So when I started the company, I had been aware at that time that pregnancy was not something 10 years ago that the fitness world really knew a lot about, but I had worked with pregnant women when I first started in fitness, and I was a dancer. So I decided when I started my own thing that I wanted to focus on and have a specialty in pregnancy, which then expanded to prenatal or postnatal healing because, you know, our clients got cleared and didn't know what to do and how to exercise safely after that. But the fertility side of it actually became something very important to me when I moved to Denver, which was about 6 years ago. And I knew a fitness professional actually who was trying to get pregnant and had some issues, and she had been doing a lot of really high intensity fitness. And so that got us to talk about, is there an element of the way that fitness is affecting your fertility, which got me really interested in, you know, doing a bunch of research, as well as talking to doctors like you. And so at that time, I went back to New York, talked to a bunch of, you know, different fertility agencies and doctors. And we felt at that time that not only, because the research is a little bit hard to find, but that it was so important because a lot of our clients were getting fertility treatments, were doing IVF, were trying to get pregnant. It was so important for us at that time to make sure that our clients were getting consistent information from their doctors and us, and for us to find out what their doctors were telling them so that they felt as safe as possible with us too, but also so that they weren't getting anything conflicting. So in general, this is what I love to do, is to talk to people like you and to find out what you have to say about fertility and fitness, to learn as much as we can as possible and to help educate women who might be really stressed out during this time, who want to know whether they can exercise and how. So
yeah, well, I think that's amazing that, you know, you have that interest in specialty, because the reality is, I do think there's a lot of misinformation or just undereducation out there. And there are studies that have looked specifically at fertility and fitness, or fertility and physical activity to be specific. And there's sort of multiple areas we need to think about. The first is, you know, is my fitness affecting my ability to get pregnant? So is it part of my underlying diagnosis? The second is sort of what is safe to do if I do have infertility while I'm going through treatment? And those are actually 2 totally different questions, and probably something that having someone like you who's familiar with the whole part of this process, number one, am I doing something in my physical activity that's increasing my risk of infertility or contributing to it? Or am I not doing something that I could do that might help my fertility? And then if I need treatment, what is safe? Because there's those are really two different questions. So hopefully we'll get to cover both of those today. And I think we're well matched because although I'm a fertility doctor, I have an interest in fitness, and I have practiced a lot of yoga, and I've even gone to India and lived on an ashram for 7 weeks, and I'm a runner. And so I actually have used fitness as part of my journey in fertility and my own treatment that I needed to go to have my children. So I think we have a lot to talk about. So let's jump in.
We do. I love that. Yeah, I also wanted to add here as we get into this conversation that if people have questions, I'm going to try to keep track of any questions that come up. I might look like I'm not paying attention, but I'm trying to write things down. So if people want to submit anything that you want to ask us during this process, please feel free. But yeah, I just thought I would actually start based on a question that actually came to me through Instagram, was somebody who was involved in fitness and things like yoga, Pilates, things like that, who's going through egg freezing. And so, for example, she was asking, I move for a living, but I feel like I don't want to do anything because I don't want to endanger myself at all. And then, basically the question is, should you exercise at all? Let's just start with a really broad question here. Is it safe to exercise when you're going through this process? Because exercise by nature stresses the body.
Right. So this question of, is it safe while I'm in fertility treatment, specifically egg freezing, which is the similar treatment process to in vitro fertilization, where the eggs are, the ovaries are being stimulated and the eggs are grown with injection hormones and the ovaries get really big. And so we do have some restrictions on exercise here simply from a safety standpoint, because the ovary gets large and there could be a complication which is called ovarian torsion if we're too physically active or do certain activities during that process. And hopefully you can see this, but I always think it's helpful to go back to anatomy. So the ovary is attached to the uterus with this little ligament here. This is called the utero-ovarian ligament. And this ligament doesn't get any bigger, but this little ovary, when you stimulate it during IVF, gets very large. So it starts to hang down and sit right here. If we're really physically active, we can twist that ovary around this ligament, and this ligament supplies the blood to the ovary. So hopefully that visual can help you understand, if you're super active and doing especially abdominal exercises, Pilates probably being one of them, or yoga with a lot of twisting movements, you could flip that ovary right around. And that could cause a complication called ovarian torsion, which is a surgical emergency to save the ovary. It's like a heart attack to the ovary. The blood supply is cut off. If tissue doesn't get blood flow, the tissue dies. So you could lose an ovary if that complication occurred. So the exercise restrictions during an egg freezing or IVF cycle are primarily related to preventing that complication. So what I tell people is, go for a walk, sit on a stationary bike. Hiking is beautiful. Potentially even like a snowshoe or something like that. Those are all great things because those involve straightforward movements like this. They don't involve a lot of movements like this. You're unlikely to flip an ovary. And so that's really what those restrictions are about. So some exercise is okay. It's probably good for your mental health as you're feeling a little bit hormonal and undergoing a stressful process. But you need to be mindful of that lateral twisting movement. Jumping would kind of cause the same concern. So exercises maybe like CrossFit or burpees or that heavy lifting, probably not a good idea during the egg freezing or IVF process.
That's great. Just quick follow-up to that. Is there a certain time frame before the egg retrieval and after that you should be especially careful, or is it the whole process?
Yes, great question. So the first couple of days of IVF medications, your ovaries haven't really grown much yet. It just takes eggs time to grow, usually 10 to 14 days. So the first day or two of shots, you're not at significant risk for that. As you approach your egg retrieval, that's when your ovary is the largest, and that's when you're at greatest risk. So I would advise people we sort of generally say, once you start your shots, kind of back off on the exercise. If you're someone that finds that incredibly stressful and doesn't want to change your exercise routine until the last minute, I would say by the 5th day of shots, you should definitely be having that moderation. And the ovary stays big for 7 to 10 days after the egg retrieval. So it's not that you immediately have the eggs retrieved and the ovaries back down to its initial size. So definitely that final week of stimulation, and for at least a week afterwards, I would keep those restrictions.
Okay, that's great. Thank you. I guess another kind of question related to safety is kind of in general, as women, you know, think about having a baby and are kind of getting ready for that process. How do they think about like what kind of exercise is safe in general? And I ask that because, you know, we have particularly found that people come to us saying that, you know, oh, I tried to have a baby for a while and I was having some issues because, and my doctor suggested that I might have done too high intensity fitness, too much cardio. And so they came to us because they found out that we, you know, we try to understand all this as much as possible. And that it's not that they were not intense, we just have a little bit more of a balance between cardio and sculpting, and again, we understand this a little bit more. And so I guess I want to kind of ask you if you know, have well, your thoughts about that. We certainly do suggest to people that if they're coming to us wanting a lot of cardio and wanting a lot of high intensity, that just in general, when they're trying to have a baby, when they're trying to get pregnant, that they consider moderating a little bit.
Yes, absolutely. Yeah. So I think this is a really important point. So this is something that I'm doing, potentially contributing to me having a harder time becoming pregnant. So there's multiple studies, and it's very well understood that there's something called hypothalamic dysfunction, which is a problem that develops in the pituitary hormones in the brain when we are overstressed. Now that stress can come in a variety of forms, and one of the common ways that we get overstressed hormonally is by over-exercising, particularly in the aerobic realm. So a classic example of this is marathon runners. If you talk to a collegiate runner, somebody who runs 50 plus miles a week, someone who's training for a marathon, almost universally their periods are going to be abnormal, irregular, or absent. And if you're not getting a regular period, what that means is you're not ovulating regularly. So you can think about your menstrual cycle as a vital sign. If you're not getting a period, you're not ovulating. There's a variety of reasons for lack of ovulation. One of them is over-exercise. Once that exercise has stopped, typically you will regain regular ovulation. And I think about this because I have a scientific background from an evolutionary perspective. Where our brains are smart. If it's a time of extreme stress, whether that's a time of famine and people are underweight, they have an eating disorder and they don't have enough body fat, or they're really stressed and over exercising. Oh, sorry, my light just went off. We're going to fix that. Then the brain says, this isn't a good time to reproduce. I need to focus on staying alive right now. So your hormones, the first hormones to change are your ovarian, your sex hormones, the hormones that stimulate the ovary, FSH and LH. So if you find that you are doing a lot of aerobic exercise and you're starting to get an irregular period, your periods are lengthening, you're skipping cycles, having funny bleeding, maybe you're tracking ovulation and you notice you ovulate and 2 or 3 days later you get a period, that's a sign that it's too much. Mm-hmm. So it's not that you can't run at all. And I tell people running's great. It's really good for mental health. Probably should limit that to maybe 3 to 5 miles 3 times a week. I think that's kind of a good guideline. Most women are not going to have their menstrual cycles affected by that.
Yeah, that's great advice. We also suggest to people that they mix it up too with sculpting and weight bearing activities too.
And I think I think if people really like to exercise every day, they're probably going to need to do that as they move into trying to get pregnant. And that's probably a more sustainable way to be healthy anyway, to make sure that you're cross training and you're not getting injured, and you have the stamina to continue exercise throughout your life. So I think a program like what you guys offer and other methods where it's not just cardio is smart when you're trying to get pregnant.
Yeah, that's great. I guess I want to ask you more specifically how exercise can support fertility. And I guess you've already spoken to it a little bit, but how might it be helpful? And I guess we can think also about weight and, wanting to be in the kind of prime weight range for fertility, but also there are things like mental health benefits as well. And I certainly have things to say about this, but I would love to hear your perspective.
Yeah, I think that's really important. I mean, we talked about this a little bit. I described this to my patients, to IVF, to my patients as we're going to lace up now for the marathon, not a sprint. This isn't fast. There's a lot of waiting. There's a tremendous amount of anxiety that naturally comes in that waiting. And at every step of the process, am I going to get eggs? Are those eggs going to fertilize? Are my embryos going to develop? I'm waiting for potentially genetic testing results. Is this embryo going to implant? Now I'm pregnant. I'm worried about miscarriage. These are really natural sentiments that couples who have struggled to get pregnant are going to go through. So I personally think, and I think there's substantial data to support, that exercise improves mood, lessens anxiety, and improves sleep. All of these things are important for couples trying to navigate the infertility journey, because anxiety levels are typically high, sleep can absolutely be disrupted, and you're on a lot of hormones, which might affect your mood, your relationships, your sexual function, your libido, all of those types of things. So I think exercise provides those sort of offshoot benefits, right? There's also been data looking at treatment dropout. So because this is truly a marathon, not a sprint for many couples that go through fertility treatment, a lot of couples will discontinue treatment because of stress, anxiety, or other stressors, even when they have good prognosis. And this was seen even in couples who had insurance benefits and didn't deal with the financial burden of in vitro fertilization or egg freezing benefits. They left treatment because they couldn't handle the stress. And I think that exercise can really help with the management of those stressors.
Absolutely. Yeah. Yeah. We focus a lot on cortisol and the fact that, cortisol can be tricky. For example, if someone has a really high stress job also, and then they work out at the end of the day in a high intensity kind of fitness, it can actually really intensify cortisol levels. Whereas, if you kind of do it the right way, you can actually lower cortisol with certain types of fitness, especially when you're really loving it. If you're really finding something that you really love and enjoy that energizes you and doesn't deplete you, that's a really great indication of what can help you, for sure.
Yeah, and I think that's why finding the joy in exercise is really helpful, right? I mean, if this is something you dread, you can't stand doing, you can hardly get yourself to do, or you're only doing, say, for weight loss, it's probably not going to be sustainable, and it's not going to make you feel better. So all of those benefits that I just mentioned and that you mentioned in regards to sort of cortisol homeostasis are not going to be there. So finding a program that really is, that you look forward to, maybe you do it with a friend, or you are doing it with a company that you really like, or a trainer that you really like, can be really helpful. I do think it's worth mentioning, because you talked about sort of, there isn't a huge volume of literature about this. I pulled a few studies just to quote, and I won't, bore you with like a journal club or anything, but there are studies that show exercise can be beneficial, specifically in the overweight and obese population before IVF. There's pretty substantial data that the likelihood of conceiving through IVF, so clinical pregnancy rate and live birth rate, are increased, especially in women who are overweight or obese prior to starting their IVF treatment. And that probably has something to do with insulin resistance and egg quality and things like that. So again, we're not going for a crash diet. The whole goal is not just weight loss, but there's probably more to the exercise than just weight loss. Other studies have looked at, is there so much thing as too much exercise before an IVF cycle? One study published a long time ago out of Brigham and Women's Hospital, which is a Harvard affiliate program in Boston, looked at women who did intensive exercise 4 hours a week or more and did see reduction in outcomes after IVF. So that's an example of probably too much. A similar study looked at a group of women undergoing in vitro fertilization who did on average 2.8 hours of physical activity every week and saw no difference in IVF outcomes. And then a meta-analysis of 8 different trials on exercise prior to fertility treatment showed overall a benefit in physically active versus physically sedentary women. So I would take that, sort of all together to say moderate exercise and exercise you enjoy and can sustain is a good idea.
Yeah, I love that. We tell people to exercise between maybe 30 to 60 minutes a day and not to exceed 4 hours a week if they're really in the midst of this. So it sounds consistent with...
Very consistent. I think that's great. Yeah.
Okay, that's wonderful. I think you touched on this issue of, what can exercise do for us? And, traditionally exercise has been seen as a way to lose weight, and women feel like I have to go hard in order to lose weight, and that's why I'm exercising, and I hate it otherwise. We as a company are really working hard at kind of flipping the switch in how we frame exercise and talking about it as a source of confidence, strength, joy, connection with others, that it should not just be for weight loss. And if anything, if we focus on other things, then whatever our goals might be actually come more naturally. But in this case, it's also being very aware of, the guidelines as well. So I just thought I might ask you, if you wouldn't mind telling us, your thoughts about fitness in that way. I think you've already kind of indicated that, fitness makes you feel less stressed and can be really helpful. It can also, for us, be such a source of joy, and we use music for that reason too, is that we want people to connect in a full body way.
And I think connecting, right? Like making friendships. Maybe you're doing a program like what you offer with a friend. So you're doing something that takes your mind off what you're going through, for one. I mean, this can become a little bit all-consuming for some people, unfortunately, where they wake up and think about fertility, they go to bed and think about fertility, and they think about it a lot in between. If you have a way to not only move your body and provide yourself some of those hormonal benefits and potentially improve your glucose tolerance and your insulin resistance goes down and all of that kind of a thing, but you're also just giving your mind a break from worrying about this and finding joy and connection with friends or a trainer or music or whatever it is. I think that this is real, and depressive symptoms have been shown to be improved even without medication, and in some studies to the same degree as medications for anxiety and depression, because of the natural endorphin and opioid releases that happen in the brain when you exercise. So I couldn't agree more that exercise should be joyful, and if it's joyful, it will be sustainable because it won't be a chore. It'll be something that you look forward to, and it probably has clinical benefits on top of it. So yeah, absolutely.
I love that. And I think when people love what they're doing, they're more apt to continue doing it on a regular basis, which might also help support their stamina through the IVF journey too.
Yes,
hopefully.
100%. Yeah.
Yeah.
And if you're working, it can be modified, right? I mean, if you normally do a 60-minute session 4 times a week, in the middle of your egg freezing cycle, maybe you do 30 minutes and you're focusing on light weights and toning and not as much cardio. I mean, I think it's just really important to be flexible with what you're doing, and being too rigid probably in anything in life isn't that helpful.
I couldn't agree more. We also sometimes include meditation at the end of our sessions too. I mean, it's not part of our method per se, but we know how to do that. And so sometimes that's what people need, like heading into a really stressful week, can we just end this workout with a meditation, and kind of brings everything down. So
I think that's great.
Yeah, this is a great question. Someone just asked, are there any nuances for different racial demographics of women?
To my knowledge, that hasn't been studied. I mean, when in preparation for this, I looked at kind of all of the published literature on exercise and IVF outcomes, and I didn't notice anything that looked specifically at the demographics of race and how that might be a role. I think there are certain ethnic differences in risks of certain infertility disorders that we know. For example, Latino women are at higher risk for polycystic ovarian syndrome, and South Asian women, Indian women are also at higher risk for that infertility diagnosis, which can cause irregular ovulation. And those women are at risk for type 2 diabetes, and weight management, so diet and exercise, is a really critical piece of the treatment of that type of infertility. So I bet you there is probably, if and hopefully there will be more studies on this, looking at what type of exercise is best for what ethnic background, or at least what diagnosis. But certainly in women with PCOS, we really want to focus on bringing the insulin resistance under control, which certainly involves regular exercise and diet.
Yeah, we would love to know that information as well, for sure. Yeah. I guess my next question for you is, I know I've mentioned our willingness and interest in connecting with people like you. From your perspective, what's the best way for us to do that? I know there's issue of consent, and, doctors don't have a lot of time. We understand that too, to, reach out to us or us to reach out to you. But what might be a really, great way for us to sort of have this kind of connection? I personally think these kinds of conversations really help this, but yeah,
I was going to say, well, I think we just started it, which is awesome. I'm so glad that we connected. I think it's really our job as physicians. Part of our job is to provide community education, and that might be going directly to OBGYNs and talking about things that they might not understand in the subspecialty of infertility because they are the annual point of contact with the patient. And it's reaching out to community providers like yourself. You know, we don't, we would never release private health or, you know, privacy information about an individual's medical history without their explicit consent. But I have had patients going through IVF who were, for example, working with an acupuncturist and using Chinese medicine, and they facilitated a 3-way call where their acupuncturist was on the phone with me. So I think if you have specific questions like that, you should ask your fertility doctor how you can involve your sort of adjunctive therapies, or get questions specifically from your trainer to bring to your next appointment. And then you can ask whatever questions you have to the physician at that time.
That's great. That's a lot of what we do now. So yeah. We'll provide them with a list of questions, or we'll talk to them about it together. About what do you want to know in relation to what we're doing together, for sure.
Yeah.
Someone asked, do you recommend acupuncture during IUI or IVF?
Well, it depends on what your underlying diagnosis is, and if you have any issues such as like a thin uterine lining or poor blood flow to the uterus or ovulation disorder. So acupuncture can be a useful adjunct in combination with other things like ovulation-inducing medications, or again, exercise. So sometimes I use acupuncture for women with polycystic ovarian syndrome, but it needs to be in conjunction with other treatment modalities like regular exercise to try to bring that insulin resistance down. So it really just depends on the patient.
Yeah. Oh, that's great. So yeah, I do want to open this up to more questions. Someone asked something too. Is there an age cutoff for egg freezing?
Well, there's not really an age cutoff, but it's important for you to understand the success rates of egg freezing are very strongly influenced by age. So probably a good idea to make an appointment with a physician and talk about, here's my age, here's my fertility testing, what are my probabilities of success, and then make an informed decision about whether or not you wanted to proceed.
Okay, that's great advice. Yeah, so I welcome anyone watching now. Do you have any more questions along these lines? Feel free to ask. Yeah, anything related to fitness, fertility alone. You have this opportunity. Yeah. But yeah, I'm interested in more research going into all of this. Okay, what is your recommendation for exercise after FET?
Yeah, so that's for FET, for those who don't know, stands for frozen embryo transfer. That's the way we do most IVF these days. And I tell people, you know, this is a time to be sort of not bed rest, but definitely taking it easy. You know that people conceive in the world going about their normal daily life, exercising, they don't even know they're pregnant. So you do not need to be on bed rest, and that has been well studied, and we no longer recommend bed rest after transfer. The day of the implantation, I advise people not to exercise. The day after, you can resume sort of normal activities like going to work. A lot of our patients might have to fly in or travel in for their frozen transfer. They can travel home the next day. You can resume a regular exercise routine after your pregnancy test, and that's 9 days after the transfer. So I'd say really light activity day of the transfer, start to build up towards sort of normal daily activities of living, like going for walks and walking your dog and things like that is fine, but no real exercise regimen in that kind of 9 days after we do the implantation.
That's great to know for us as well. How is IUI different from IVF in terms of like the time frame to exercise?
Yeah, so for IUI, you're really just simulating conception in a natural cycle. You're putting sperm close to the tube. The sperm have to swim into the tube, find the egg, fertilize it, and travel down through the fallopian tube. So I'd say regular, moderate exercise, as we discussed earlier, you know, maybe 3 to 5 days a week, 30 to 60 minutes is totally acceptable. The entire IUI process, the day of the IUI, the sperm are not staying in the uterus, they're swimming into the tube to find the egg. So totally fine to resume a regular exercise routine throughout that process.
That's great. Yeah. Someone also asked about BMI, what's ideal for IVF. I'd be interested in your take on that. We've heard something between 20 and 25, but the BMI can be a little bit tricky because it's not always, it can be influenced by, you know, how much muscle you have. It's not necessarily related to obesity. Say, or that it's more like body fat percentage. I'd love to hear your thoughts.
BMI is always a little tricky, right? Because some people are more muscular, etc. But studies have shown that there's reduced outcomes in IVF over a BMI of 30, which is considered obese. The BMI of 30 and above falls into the obesity category. 25 to 30 in the overweight category, you might get less eggs and respond less well to hormonal stimulation, but probably not super detrimental to your IVF outcome. Low BMIs, definitely under 18.5, have been associated with poor outcomes and increased risk of pregnancy complications. So I think the 20 to 25, that's a really ideal body range for probably most health outcomes. Fertility probably falls in there, but I don't worry too much between 18 and 30.
Yeah.
Okay. And one other question I saw pop up, someone asked about, is there exercise concerns when you're preparing for the frozen embryo transfer? So like when you're on estrogen rebuilding the lining, no restrictions there. No reason you can't do whatever at that point, because there's no embryo in the uterus at that point, and we're not stimulating the ovaries. The ovaries aren't big at that point, so no restrictions on exercise at that point.
Okay, that's really great. Yeah, and I see some other questions kind of related to some things we talked about at the beginning, so please welcome everyone to watch this when it's recorded to see some of these answers that you gave earlier. So yeah, I just want to give a couple more minutes for any additional questions. Yeah, and I wanted to mention too, I like to talk about how people can reach us. So you're located in the Denver location, correct?
Yes.
Specific building in Denver?
Yes, so we have 3 locations in Colorado. Our main office is in Lone Tree, Colorado. We have a satellite office in Denver proper, and then we also have an office in Louisville. And I work at both the Denver and the Lone Tree locations. CCRM has many other locations across the United States and one in Canada as well. And so you can, and we're offering telehealth and in-person consults at the current time. We do here at this location treat a lot of out-of-state and international patients. So even if you're watching this from somewhere that's not drivable to Denver or Lone Tree, we're still happy to take care of you.
Yeah, that's great. And I wanted to mention too, you can reach us here on Instagram. Our handle is @bodyconceptions. We do virtual, as I mentioned. We also have trainers who are in person in New York City as well as Denver, and we have someone in San Diego and Dallas too. So yeah, feel free to reach out to us whenever you can and want to. We also have on-demand videos as well. I saw actually a few questions here about holistic teas that are coming up. Thought I would pass that along too.
To my knowledge, there's not really any good trials looking at holistic teas as you go through IVF treatments. I think it's important to understand if you're taking herbal supplements of any kind to make sure you disclose that to your physician. Because there could be things that maybe aren't safe, especially around the time of an egg retrieval. Some supplements might, for example, increase the risk of bleeding during a surgery. So, I think it's just always important to discuss what exact supplements you're on with your physician. But for the most part, tea is totally fine as long as it's things like chamomile, peppermint, even a little bit of caffeine as you're going through the fertility process is okay. But there's caffeine in a lot of things: coffee, chocolate, tea, other foods. So it's, soda. So it's important that you really pay attention to what your overall caffeine consumption is.
That's great. Yeah, I think this really captures it. Thank you so much to everybody for coming and being part of this, for sure. Thank you, Dr. Barton, also for answering my questions. I've taken a ton of notes because there are a lot of things we want to know working with clients and doing fitness with people getting fertility treatments. But yeah, thank you.
Well, Mahri, thank you so much for being here and being so thoughtful about helping our patients navigate this journey. We need more people like you who care to take the time to learn about this and help women through this, or couples or individuals or people. So thank you so much for having me, and we're here for you if you need us.
Okay, take care.
Okay.
Bye-bye.